All right, hello everyone. Good afternoon and welcome. Thanks for joining us today. In the digital age, we see an alarming increase in misinformation and disinformation about time tested and science backed medical practices that save lives and prevent serious illness. Chief among them are the small but meaningful tide and shift against childhood vaccinations. Here in Michigan, we believe science should win the day. We also understand the importance of parental and caregiving choice when it comes to medical decisions for children. If, for that reason, someone has come to the conclusion that vaccines are not best for their children, they have the right to refuse them. And that will continue even beyond this package. But the parental choice, which is protected in Michigan law, has begun to infringe on a different but equally important right for other parents: the right to choose what is safest and best for their children and where to receive their education. Between 2024 and 2025, there has been a 36% increase in measles in Michigan. And in 87% of the cases reported this year were outbreak related, meaning that they were not just some random occurrence, but in a concentrated area, like a school. While for some, measles may only present as a bad cold, the reality is that for hundreds of thousands of infants, for seniors, for the immunocompromised, for children across this state, measles can mean long-term implications and complications to their health. Sometimes it even means death. And this is true for many similar illnesses. Like we are seeing child deaths from whooping cough in Tennessee. Thankfully, we are able to prevent these diseases and protect them through childhood immunization schedules. Yet that herd immunity is waning as a growing, if still small, number of parents refuse to vaccinate their kids. And if they are not concerned about the health of others and the well-being of others, that's their right. They don't have to be. But you, as a parent, have the right to know if your child or someone else in your household is in danger because a meaningful number of your child's peers are unvaccinated. Today, my colleagues and I are here to introduce the Empower Parents and Protecting Communities package, which will make information about immunization reporting easier to organize and access in order to give families the tools that they need to make the education and healthcare choices that work best for them. While individual names will still be protected and withheld, that's basic HIPAA law, parents who have an infant at home or care for an ailing mother or father on the weekends or have a child with a heart condition will now be able to easily access data on vaccination rates for those locales in their areas. This will restore the rights of parents to make informed choices possible about what daycare to send their 8-month-old to, 8-month-old, that doesn't sound right, 8-month-old to, or what school to enroll their kindergarten in. Not only that, but with coming changes at the federal level, our package will protect access to parental vaccination choice in Michigan by ensuring that parents who do wish to adhere to the prior science-backed vaccination schedule can receive full insurance coverage and the medical support to do so. Every parent has the right to do what they think is best for their child. And while Michigan law has so far emphasized the right of individual parents to make choices that dissent from standard medical practices, our package will restore the balance in protecting the rights of every other parent in that vicinity as well. So to speak a little bit more on the importance of this package, I'd like to introduce my friend and colleague, Representative Morgan Foreman.
Thank you, Representative Skaggs, and thank you to everyone joining us today. I'm State Representative Morgan Foreman, and I represent Michigan's 33rd House District in Washtenaw County. As a Black woman, my experience with the healthcare system has been very different from that of my colleagues up here with me today, and that shouldn't be of any surprise. We know the staggering and horrific rates for Black health outcomes across the state and country. For example, in Michigan, Black women are 3 times more likely to die from childbirth complications than their white counterparts. And nearly 64% of maternal deaths in Michigan between 2018 and 2020 were deemed preventable. That is only one of the jarring statistics which underscore how far we still have to go for true healthcare equity in the state and country. Breaking down barriers and reducing stigmas is critical to addressing these disparities, but that just does not begin or end in a hospital setting. This past fall, the percentage of vaccination waivers requested for new students in Michigan reached a 12-year high. Basic science tells us that more people who go unvaccinated against preventable illnesses, the more likely an outbreak of that illness is to occur. And basic math tells us that when you have more unvaccinated children than the state has seen in more than a decade enrolling in school, more outbreaks are going to occur. Communities of color face a greater number and greater intensity of illnesses. We could spend hours talking about the historic and systemic inequality that has led to some of those differing outcomes. But when you have someone who's already sick, catching a preventable serious illness like measles or pertussis, what we know as whooping cough, is life or death. Families, particularly in areas where there is an overwhelming number of schools or childcare facilities to choose from, have the right to know if they're sending their child or toddler or their student to some place where the likelihood of them bringing home one of these illnesses to a vulnerable family member is significantly higher. Because at the end of the day, what we all want is peace of mind and the assurance that our families are safe and healthy. Our package ensures that families who choose not to immunize their children and families who cannot afford the risk of those preventable illnesses can both have it. At this time, I'd like to introduce Dr. Azevedo from Michigan State University.
Hello, my name is Lauren Azevedo. I'm here as a pediatrician in the East Lansing area and president-elect of the Michigan chapter of the American Academy of Pediatrics. When kids stay healthy, they can focus on growing, learning, and doing things that they love to do. Childhood and adolescent immunization sets up young people for long-term health and well-being. We must make sure that childhood immunizations are widely available, easy to find, and affordable to everybody. Caring for our community means removing barriers that families run into when trying to get their kid immunized. Every day I wake up and think to myself, how can I be a better parent today? How can I be a better pediatrician today? And part of that is ensuring that those who want the choice to vaccinate have access to that choice. In my experience, I have seen clinics that are unable to provide vaccinations to families that want it, which imposes incredible challenges on those families who then have to travel to different clinics, spend long times on the phone with their insurance companies trying to figure out what's covered. And all of this creates barriers to those choices, which we all know are so important. With that, I'd like to turn the floor over to Representative Littlejohn. Thank you.
Thank you. Before I go more into the package, I want to remind everybody why we're here today. We're here today because today is the day that RFK Jr.'s hand-picked team of vaccine science deniers are meeting in Atlanta to review the entire childhood and adolescent vaccination schedule. On their agenda are proposed sweeping changes to the way that children across this country would be immunized and protected against vaccine-preventable diseases. Their reckless actions require state-level policy responses, such as the Empower Parents and Protect Communities package. For decades, the CDC's Immunizations Practices Committee, or ACIP or ACIP, has had an impeccable reputation for following the best available scientific evidence related to vaccines and immunization practices. And the ACIP's recommendations have become so trusted that many other policies and programs are built around their work. Doctors' offices, pharmacies, schools, and even insurance companies regularly rely on the ACIP recommendations to guide their own internal policies and practices. Vaccine manufacturers base production and inventories on ACIP decisions. Medicaid and Medicare automatically cover with insurance the vaccines recommended by the ACIP. In recent months, RFK Jr. has hijacked this committee, ousted top vaccine experts, installed his anti-vax allies, and pressured CDC officials to rubber stamp his agenda. The chaos, confusion, and distrust being engineered by RFK and his quackery are causing vaccine skepticism to rise, vaccination rates to fall, and risks of infection, illness, and death to increase. And this is already happening. In 2025 alone, outbreaks of measles have become more frequent and harder to contain across the country, and at a higher level than at any point this century. Over 1,800 cases of measles have been reported this year, and in January, the United States is expected to lose its 25-year-long status as a country that has successfully contained measles. In this challenging time, the single most important thing that patients and parents can do is talk to their doctor. Talk to their doctor, their pediatrician, and make informed decisions about what's right for themselves and their loved ones. But any respected medical professional will tell you vaccines save lives. Vaccines save lives, and there is no clear, reliable, reproducible, or significant evidence that vaccines contribute to autism. Michigan, like many states, is already taking steps to ensure information needed by parents, patients, providers, schools, and the public will always be evidence-based and consistent with the most up-to-date science. In September, the governor issued an executive directive, and Dr. Bagdasarian, the state's chief medical executive, issued a standing recommendation for pharmacists and other qualified health professionals in Michigan to administer COVID vaccines to people who would not get them under RFK's policies. The bills in this package should only help the state to be more effective in protecting the public's health. One bill includes a mechanism for MDHHS to break with the CDC guidance when needed to ensure that vaccination recommendations for Michiganders reflect the best medical science. It calls for the department to incorporate findings and recommendations from reputable medical organizations like the American Academy of Pediatrics, the American Academy of Family Physicians, the American College of Obstetrics and Gynecology. Another bill in this package would grant the state's chief medical executive the authority to issue standing medical orders to pharmacists, public health nurses, and other qualified health professionals to administer vaccines outside of a standard medical appointment, saving families who want to vaccinate their children from having to wait weeks or months for a doctor's appointment. The bill sponsored by Representative Rogers lifts up the important work of the MACI, the Michigan Advisory Committee on Immunizations. The MACI has been advising the department since Governor Engler's time in Michigan and consists of Michigan's top vaccine scientists, researchers, healthcare providers, and medical and public health experts. It acts like the CDC's ACIP and can help the department identify when it's called for to diverge from the ACIP recommendations. The final bill I want to highlight is the one sponsored by Representative Brenda Carter, which will ensure that insurers operating in Michigan will cover the vaccinations ordered by the chief medical executive or recommended by the department. In closing, the Empower Parents, and Protecting Communities package makes information about immunization reporting easier to organize and access while still protecting individual privacy and choice. It gives families, pharmacists, doctors, insurers, schools, businesses, and health departments the tools they need to ensure Michiganders can live their healthiest possible lives. With that, we'd be glad to take any questions that you may have.
Representative Longchamp, I know that we've had some issues with the COVID vaccine and some side effects that have been harmful to some people. On other vaccines, what's been the what have you heard on the side effects for like measles or mumps, and have those vaccines changed over time, or are those kind of the same thing over and over again?
Yeah, it's a great question. Any medication, but really any substance we put into our body, whether it's prescribed or not, if not dosed correctly, can have side effects. Drinking too much water, right, can lead to important side effects and even death. So all medications have some potential risks as well as benefits. And that's why it's so important for everyone who has questions about this to talk to their healthcare provider, who can spend time with them and their family to figure out what the best medication, in this case vaccinations, might be for their family. In terms of specific side effects to specific vaccinations, again, there are always some risks, whether it's a sore spot on the arm where you get the injection, or any number of other things that may pop up in very small and rare cases. What we know is that vaccines save lives across the board. And again, I want to encourage people to talk to their docs, their medical professionals about their specific instances. But your other question is about how does this evolve? And that's the story of science, right? We test things, we retest things. When the ACIP was doing its work for decades in a reputable way, changes were frequently made. We've gone from having thousands of antigens in vaccinations to dozens by identifying fewer and fewer triggers for the immune responses we want to see in people's bodies. So each vaccine has its own kind of list of both risks and benefits, whether it's for measles, mumps, rubella, whether it's for polio, whether it's for diphtheria, whooping cough, or COVID. But again, I just want to stress the most important thing that people can do is see their health professional to get the answers they need.
And just to follow up, because I know the COVID strand is mutated and changed dozens of times, but what about like the mumps or the measles? Is that strand kind of consistent, or is that evolved as well?
Viruses are all different, right? So COVID has mutated more frequently than a lot of other viruses. But if you think of the history of influenza, for example, one of the most important things that the CDC's ACIP, the committee that we all have trusted for so long, does is it anticipates the genetic shift for influenza every year. The reason why people get influenza shots every year is because the risks of influenza change every year as the genetics of that virus change. And so every year when the first outbreaks occur, just like clockwork, they start almost always every year in China and move across the globe in a regular pattern. We can anticipate from what's happening around the globe what the vaccine needs to be for next year if we have the world's best experts on the ACIP making decisions based on evidence. What we have in Atlanta, what we have RFK doing today is bringing an agenda, and that's going to put people at risk and cause illness, infection, and death. Other questions?
One question, boring. Do we have bill numbers for this package yet? More exciting question would be with providing this information for people from the state of Michigan about vaccination rates, what they do, known effects. If people are already mistrusting what experts are telling them about vaccines, how does providing information from the state get at that mistrust?
Yeah, I will give a brief answer and then hand it over to Representative Skaggs, because some of the bills in this package, which don't have bill numbers yet, as you know, for various reasons, including the ALEC conference, the House Republicans have decided we aren't in session this week. So we won't be enrolling these bills until Tuesday, and that's when we'll get bill numbers. But part of the magic of this package in my mind is that it's actually creating policy that will make sure that parents are getting information from the people they trust the most. Their childcare providers, their schools, right? Right now, the data that exists on building level vaccination rates for schools across the state end up on a web page someplace once a year, and enterprising reporters might find that database and write a story about things that Representative Skaggs might talk about in the Grand Rapids area, for example. But there's never been that last mile of communication. We haven't had a handout from a school to a parent at the end of the school year saying, this is what our vaccination rates are, and before you send your kids back here at the end of summer, you might want to consider whether you have an older adult that's immunocompromised in your house, or a breast cancer survivor, or something like that. Because as these kids walk into these petri dishes, they bring those risks home. Do you want to talk to this, Phil?
Well, you cheated up, so I feel like I must. So just to answer a little bit, I think it's important that the vast majority of parents are trustful of the best science-backed, data-driven research that exists around vaccines. So there may, and there always has been, a small percentage of parents who have decided to not vaccinate or delay vaccination for their children. That number is growing slightly, and it isn't endangering the 95% general rule of thumb that we need for herd immunity. That's part of the reason that we're here. But we believe that parents who are considering sending their child to a kindergarten, sending them to a school, that they deserve to have the information that if I send my child there, are they at risk beyond what I would like to have of bringing that disease home, of spreading a contagion around the community, of endangering their grandparent who might be living with the family, or their young newborn sibling. Parents deserve the right to be able to make informed decisions, and that's really what we're here about today. So we do believe that if a parent sees, and there is a school in Grand Rapids that has become a place where vaccine skeptical or anti-vax parents are sending their children. It's a charter school. It's also nowhere near a local public school. And so there are parents in that neighborhood that are likely sending their child to that school because it's the closest one that they can walk to or bike to. But unless they're able to just happen to see the once a year media report in MLive that talks about vaccine rates in their school, they would have no way of knowing that they are potentially putting their loved ones and their community at risk by sending their child to that school. So those parents that are trustful of science also deserve the right to be well informed.
Probably a good question for our pediatrician or anybody else who feels like they can answer. But as far as what you see at the community level when you're talking with parents and families, what do you hear from them about distrust of vaccines? Are you seeing in your office a little bit more of a distrust of vaccines? And sort of secondary to that, how would you walk families through making that kind of choice and maybe having difficult conversations about what kinds of steps they should take if they're wary of vaccines?
I think that that's a wonderful question, and I think that this is where a really important concept of the provider-patient relationship called shared decision-making comes into place, where we have the opportunity to sit down with our patients and they can sit down with us and we can go over all of those risks and benefits. One thing that I've seen in my own experience is folks that come in and they have very, very valid concerns, but those concerns may be based on misinformation. And so that's an opportunity for us as healthcare providers to sit down and give them a chance to then interpret the science that we have, the evidence-based medicine, and make decisions based off of that. So that's where I counsel families a lot, is just giving them a chance to talk to me about, these are my concerns, these are where my concerns are coming from, and how can we talk about that? I mentioned earlier, I always wake up and say, how can I be a better parent today? And I think everyone wakes up and says that. Everyone's trying to do what's best for their child. And our job as healthcare providers is to make sure that people are empowered to make those decisions with information that is robust and supported by science.
I think that's a wonderful question, and does lead into one of the bills that I'll be sponsoring that maybe hasn't quite gotten the coverage here today, which is to take the policy that was implemented over a decade ago by the DHHS under Republican Governor Snyder, to move towards clarifying how one gets a non-medical waiver on vaccinations. So we're taking that Snyder era, and I want to say Rick Snyder, so we know we're not talking about Will Snyder, that Rick Snyder era DHHS policy that encourages and requires the parents to get the information from a health professional and help establish that relationship between that health professional and those parents so that they can make the most informed decision. That's currently just policy. It's not in statute. In the original House Republican budget, it included boilerplate that would forbid the DHHS from implementing this policy. So we know that there are folks out there that are looking to step in the middle of this doctor-patient relationship, and we want to make sure that that policy, which has saved lives, saved children's lives, which is why we are here, remains in effect, and it's going to remain in effect when it's in statute.
I guess for Representative Long John, you had mentioned a meeting happening today in Atlanta. I'm wondering, what do you see as the stakes, or if you can outline the stakes of what happens if this package doesn't become Michigan law? What do you see happening?
First of all, just directly dealing with what's on their agenda. Their agenda includes reviewing the effectiveness of a system called the Vaccine Adverse Events Reporting System, or VAERS. It also, which is the way that we look for side effects of vaccines. It is a mechanism where people self-report what their experience was after getting a vaccine. And so if I got a vaccine, but then got hit by a car, I might say after my vaccination, I got hit by a car, but that doesn't mean that the vaccine caused me getting hit by a car. But the VAERS system is a self-reporting mechanism for patients who've been immunized to report adverse events. So we know that that's some of the source material for RFK Jr.'s anti-vax misinformation. So what will come out of that discussion, I don't know, but it's on the agenda. Another thing that's on the agenda is they're talking about moving back the infant dose of the Hep B vaccine. Hepatitis B is a serious, serious thing, and since we've gone to having the first dose of a Hep B vaccine delivered on the day an infant is born, we've cut the number of Hep B infections for infants by 90%. They want to delay that. And the estimates I've seen from credible vaccine science say that that might result, just even a slight delay, might result in as many as 500 extra infant deaths in the next year. And then also on their agenda on Friday at 5 p.m., when none of you will be covering what they're doing, is when they're voting on the childhood and adolescent changes to the adolescent and child vaccination schedule. So, those are all independently serious risks for families across the country. But the other kind of more subtle, insidious risk is that by doing what they're doing, they're just adding to the confusion. They're adding to the chaos. They're delaying people's decision-making, delaying treatment, and treatment delayed is disease. So we have to recognize that it's not just the direct impacts of the decisions they'll be making in that meeting. It's this whole aura of anti-science, anti-vaccination agenda that goes into their deliberations down there.
So is it fair to say you see this package as a way to counteract whatever we come in?
Yes, absolutely. I'm proud to stand here with my colleagues on this because, states across the country are acting, and Michigan has already been acting. But there are some things that Michigan could do that we cannot do as a state unless we have policy change. For example, the standing recommendations that Dr. Bagdasarian issued in September around COVID vaccination, they are standing recommendations to pharmacists. And pharmacists are still getting information from RFK's FDA, so many acronyms here, that say that only people 65 and above should get that COVID vaccine. That is not what the science says. So Dr. Bagdasarian's recommendations include that pharmacists should give vaccinations for COVID to people outside of what RFK's policy would have them do. But she can only issue recommendations. Providing the authorities to give an order requires statute. So that's where Michigan and other states around the country, at least 15 of them, have declared emergency orders or joined together in coalitions or done any number of things just like Michigan is going to do with this package.
Can I ask?
Please.
So another direct thing that might happen, if the ACIP committee fails to make a recommendation about the childhood vaccine schedule tomorrow at 5 p.m. when nobody's paying attention, health insurance companies will say, cool, we don't have to cover that anymore. And this is America, where how you pay for something in the healthcare space determines basically if you get it. And so if ACIP decides that this is not recommended, the same schedule, or makes drastic changes, health insurance companies who are motivated by profit, sometimes not motivated by what's best for the population, they will save money if they don't cover something. And they may choose to not cover it and actually make more money for themselves and their shareholders. So that's a big problem, because what we all, like what we're elected for, what we got sworn an oath to do is to protect the people, not to protect the pocketbooks.
We have time for one more question if there is one.
Yes. Have you spoken to your colleagues in the Senate or across the aisle in the House about getting something done on this, coming together and actually passing this?
We're always in continuing conversations with our colleagues in the Senate, and those continue. So yes, some preliminary discussions have been had and will continue over the next couple of days as this package gets introduced.
I would add just that we will be putting these bills up on Tuesday. We encourage Republicans in the House, as well as all of our Democratic colleagues in the House, to sign on to these bills because it's what's best for Michiganders. It's not just bicameral. We would love to see Republicans understand what's best for Michiganders too.
Yeah, absolutely. This has been a bipartisan issue for years and years, and it's unfortunate that we have started to see some movement away from that, but we welcome all of our colleagues to join in on this really common sense package that is going to save lives, because we are seeing deaths across this country. There are 3 children dead in Tennessee. And what my colleagues want to do, and what the people who will support the bill package want to do, is they want to protect kids. Our graphic says protecting communities, and communities are really important, and communities include kids. But I think it should be clear what's going to happen given the attacks on vaccines. People, children, are going to die. And it is our responsibility as elected officials and as parents and adults to protect those children, and that's what this package does.